Good morning, everyone. It is my pleasure to welcome you to our 14th annual Holistic Health Seminar on Memory Loss, organized by the Memory and Aging Community Advisory Board, also known as McCAB. My name is Ernestine Jones Jolivet, and I am the chair of the Seminar's Planning Committee and the McCAB's Board Development Chair. Thank you for joining us. We have a fantastic morning planned for you. Before we dive into our agenda, I would like to invite Reverend Terry Williams, Senior Pastor, Milford Mill United Methodist Church and Salem United Methodist Church in Baltimore County, to lead us in an opening prayer.
Good and gracious God, we thank you for allowing us to be able to be on this call today. We are so grateful for the work of the McCAB organization as they continue to bring us useful and helpful information regarding memory loss, how to deal with it, how to understand it, how to work with those within our family and friendship boundaries who are suffering from it. We are grateful for this opportunity of learning. We look forward to better understanding, walking away with tools we need that will assist us. And once again, such that we can all be together to learn together, to understand it and grow with it and feel like we're not alone in it. We're very grateful for the opportunity. And with that, I say amen.
Thank you, Reverend Williams, for such a warm opening prayer to lead us into our day's activity. Let's get started with our program. For those of you joining by Zoom, you can see today's agenda on the screen. As we'll learn this morning, there are many ways to care for our health and wellness as we age. Additionally, the need for self-care is particularly important for those of us who are in caregiver roles. The theme of today's seminar is education and resources for a healthy mind, body, and spirit. Today's event will feature presentations by individuals with expertise in health services, brain health and memory loss, caregiver stress and wellness, caregiver resources, and spiritual well-being. We will also get our blood pumping with our interactive virtual exercise demonstration. Despite the fact that in 2021, Alzheimer's disease and other types of dementia, as well as other conditions such as diabetes, continue to disproportionately affect African Americans. While the reasons for these disparities are not well understood, it's important to know that there are things we can do to reduce our risk of these diseases. But health is not just the absence of sickness and disease. According to the World Health Organization, health is a state of complete physical, mental, and social well-being. This definition embodies the holistic approach to wellness that we hope to emphasize today. Since this is our first year hosting a virtual holistic health seminar, I'd like to briefly review some Zoom features. Today's event will be recorded. After the event, the recording will be posted to the McCAB website at www.baltimoremccab.org. We will distribute this link by email once the recording is available. Second, if you would like to ask a question, please click on the Q&A button on the bottom of your screen. You can ask a question at any time by typing your question into the box. Our event moderators will read the questions to our speakers on your behalf during the Q&A portion of the event. Third, Throughout the event, we will use the chat box to send messages to attendees and share links to helpful resources. Lastly, we will be inviting you to complete a post-event survey. This will help us gauge the success of our event and how we can improve in future years. To show our gratitude, the first 200 individuals who complete the survey will receive a free macabre face mask by mail. The link to the survey will be put in the chat box at the end of today's event. Rest assured, the link will also be sent to you by mail. The survey will only take a few minutes to complete. With our Zoom housekeeping now complete, I would like to take a moment to give a big thank you to our event sponsors. This includes the Memory and Aging Community Advisory Board, the Johns Hopkins Alzheimer's Disease Research Center, the Greater Maryland chapter of the Alzheimer's Association, the Baltimore City Health Department's Division of Aging Services, the Baltimore County Department of Aging, MedStar Good Samaritan Hospital, Town Square, Time Printers, CSC Logistics, and Epworth United Methodist Chapel. We appreciate their support of today's event. Now that we've met our sponsors, we would like to get to know you, our audience. For those of you joining us by video conference, we have 3 poll questions that will appear on the screen at the same time. Our apologies to those joining by phone. You will not be able to complete these poll questions. These questions will ask, how many times have you attended the Holistic Health Seminar in the past? Your age and your race and ethnicity. We'll give you about 60 seconds to reply to these questions by clicking on the response that best applies to you. They're coming up on your screen now. Get started. Oh, well, it looks like we have a lot of people who it's their first time. Welcome. We're so happy to have you. And we look at the age range of our participants, and I would say that they're in the range of 60 to 69 years old. Excellent. And 75% of the participants attending today are African Americans. Thank you for responding. Now let's turn to the first speaker on our agenda. It is my honor to introduce Dr. Sharita Hill Golden. Dr. Hill Golden is the Hugh P. McCormick Family Professor of Endocrinology and Metabolism at the Johns Hopkins Hospital. In addition, Dr. Hill Golden is the Vice President and Chief Diversity Officer for Johns Hopkins Medicine. In this role, she leads the institution's efforts in its commitment to diversity, inclusion, and health equity. This morning, she will be providing an update on COVID-19. We will have a short Q&A afterwards, which will be moderated by myself and Rosti Bridgeco, my fellow McCAB member.
Good morning. Thank you. I normally call her soror Jolivet. So I'm gonna I'm gonna still call her that in this setting because we're in the same sorority, Delta Sigma Theta Sorority Incorporated. But thank you for your generous introduction. And what I was asked to do was to provide an update on COVID. And it's really timely because everything seems to be changing very quickly. So I'm just going to share my screen. And what I thought I would do this morning, we just recently, and you all should have received this in your this toolkit information in your handout, but we recently, put together resources just to sort of go over what are the things we need to know about COVID now, particularly as it relates to the vaccine. And so a lot of what you're hearing on the news is the good news that the COVID infection rates are really declining rapidly. This is due, I think, to two things. One is that, we are now, I think it's over 50% of the US population overall has been vaccinated, which is very encouraging. And then now that the weather is warmer, we're able to be outside more. And so certainly when we are indoors during the winter months, then we're in closer proximity. So there's a greater likelihood for not only COVID-19, but all viruses to spread. So these are sort of the 12 things to know about the COVID-19 vaccine, because I mentioned that half of the US population, a little over half is vaccinated, but that means half is not. So there's a significant proportion of our population that's still at risk. So one of the things is that, I just want to go over sort of some 12 facts about the COVID-19 vaccine. So, getting the COVID-19 vaccine can protect you from getting sick. And so what the vaccines do is they work with your immune system so your body will be ready to fight the coronavirus when you're exposed to it. And I'll talk in a few minutes about how the vaccines work. People of color, and I want to spell out in particular individuals who are Black, Hispanic, or Latinx, and also Indigenous or Native American are the communities that are at greater risk of having severe COVID-19 and death from the disease. That's why it's particularly important for our communities to be vaccinated. And then also getting the COVID-19 vaccine helps others in the community. So older individuals, those with chronic medical conditions are more likely to experience severe and even fatal COVID-19. And so, I think of the vaccine as being your brother's keeper. And so by protecting yourself, it also helps you to protect others in the community so we can stop the spread. And then it also means that getting vaccinated is a chance to return to some of your regular activities. And so I am so excited that my son will graduate from Northwestern University next week. And we just never envisioned that we'd be able to see him walk across the stage in person. But because we've all been vaccinated, they're able to do that on a smaller scale, but still able to do that. The fifth is that though the COVID-19 vaccine development was fast, it did not skip steps. And I think this is very important. We all heard that name, Operation Warp Speed. And really what Operation Warp Speed was there was a financial investment up front by the government as well as private industry to really be able to recruit all of the people that we needed to recruit for the trials. And then, typically what will happen is you recruit people into a trial. That process can often take years because for these trials, for the 3 vaccines that currently have an emergency use authorization, we have Pfizer, Moderna, and Johnson & Johnson. Those trials had between 30 and 40,000 people participating in them. So they were very large, which they need to be large to be able to show whether or not the vaccines are effective. So normally that process can take years, but because of the financial investment up front, they were able to really accelerate that process over a period of a few weeks to months. And then the other thing is that there are often 3 phases to getting any kind of medication, vaccine, or device approved. So, you have your phase 1, phase 2, and phase 3 part of the trial. And because of that financial investment up front, when phase 1 looked promising, they were able to move very quickly to phase 2. And so then when phase 2 was looking promising, move to phase 3. So some of the phases were actually occurring in parallel. And so the reason that was so necessary is because people were dying so quickly. I mean, we were talking about, tens of thousands of deaths daily. And so that was why that investment was made up front. So even though the process was faster, there were no steps skipped. And that was a really important part. So the rigor of the scientific process was still in place. The other thing is that the sixth point to remember is that diversity in the COVID-19 vaccine testing helped to really assess its safety and effectiveness. So one of the first questions I had was, were there people that looked like me enrolled in the trials? And so in the Pfizer trial, there were 10% of the individuals enrolled were Black, and they so that in that trial there were 30,000 people, so that means 3,000 of them were Black, all recruited from the United States. And then in the Moderna trial, there were 40,000 in that trial. So 10% being Black means there were 4,000. And then in the Johnson & Johnson vaccine trial, 19% were Black. So large numbers. And then among the Hispanic and Latinx community in each of the trials, it was anywhere from 20 to 25% were Black. So this is really important because it actually showed that the vaccines are effective in the populations who are being most adversely impacted. And in addition, people who had chronic conditions like diabetes, high blood pressure, Alzheimer's disease, other diseases were included as well. So that was really important. The population looked like those that we are most concerned about. So there are side effects from the COVID-19 vaccine, but they are temporary and don't mean that you're sick. So, often when we get our flu shot, we'll have a sore arm, feel achy the next day, and that usually resolves. The same thing happens with the COVID-19 vaccine for many people. That means that your body is actually mounting an immune response. So I remember when I got my second vaccine, I got Pfizer, and by that afternoon, I was having some chills and achiness, and I was like excited because I was like, okay, this means that my immune system is responding. Now, if you don't have side effects, that doesn't mean the vaccine is not effective and is not working. Because as we get older, and as my parents would say, wiser, our immune response, we don't feel that as much as we do when we're younger. But again, the vaccine itself does not make you sick. If you feel any side effects, it means that it's working. One other question people have is if you have allergies, should you still get the vaccine? And for most people, the answer is yes. People with allergies to certain foods, insects, latex, certain common allergens can get the vaccine. The only contraindication is if you have an allergy to either that first shot you had, or if you have an allergy to any of the ingredients in the vaccine, and they will show you the ingredients before the vaccine, before you get it. Another point is that there's a question about pregnancy and breastfeeding and fertility concerns. And so women who are pregnant should discuss with their doctor about getting the vaccine. I will say that women who are pregnant who contract COVID can have a very poor outcome. So I know of pregnant women who opted to get the vaccine. The vaccines are safe for breastfeeding mothers. And there's a recent study that shows that for women who got the vaccine when they were pregnant, that the immunity that they generated in response to COVID-19 actually did get transferred to the baby. So that means the baby's protected in the first 2 to 3 months as well. And then, the other thing to point out is, as I mentioned, time is of the essence. And so now we have a lot of people are saying, well, I want to wait and see. So now we've got 700 million people in the US who've gotten the COVID-19 vaccine. So chances are, someone who's gotten it. And so it's really important to get the information because we need to use this lull that we have during the summer to get most of our population vaccinated so that when the fall comes, the majority of people are protected. And one other thing to say is that vaccines can't save lives unless you get vaccinated. So having vaccines is not helpful if they actually don't get into arms. So those are some things. So I wanted to just explain a little bit about how the vaccines work. And I know one of the other things is that there was a lot of discussion about this is a new technology. And that was a thing for me. I was like, what does that mean? And what I learned is that technology using the messenger mRNA is a technology that had been developed over the last 9 to 10 years before this pandemic. And the reason they developed that kind of technology is because they were concerned that if we ever have a pandemic with an infectious disease like we have now, we would need to be able to develop a vaccine much more quickly than our traditional approaches, where we, grow the vaccine and egg yolk and all of that takes a lot longer. So I think the other thing that I found encouraging is that technology, one of the lead scientists at NIH that has been leading that work is Dr. Kizzmekia Corbett, who's an African-American basic scientist. So that was really exciting for me to learn. So there are really 3 main types of COVID-19 vaccine. So there's the mRNA vaccine. Those are the Pfizer and Moderna use those technologies. And then there is protein subunit and vector. Those are the three types. So just basically what they all do is at the end of the day, help your body to develop an immune response so that it will recognize the virus. So with the mRNA vaccine, it's basically a molecule that tells our body how to make proteins. So in our cells, in the nucleus of our cells, we have something called DNA. And the way I think about this is if you're going to like remodel your kitchen, then you have that blueprint that tells you what the kitchen is supposed to look like. That's like our DNA. But you've actually got to, with the blueprint, just having the blueprint doesn't make your kitchen different. What makes your kitchen different is, like the contractors need to come in, they need to come in with the wood, they need to frame everything out, they need to put in new cabinets, put in the countertop. So those the contractors are translating your blueprint into the kitchen. And so that's what mRNA does, is it sort of reads the DNA and translates that into the proteins that our cells need. So what is happening with an mRNA vaccine is that in that vaccine, there is the mRNA to what's called the spike protein on the coronavirus. So if you notice, if you look at pictures of the coronavirus, it has those little spiky things sticking up, and corona means crown. So that's where it gets that coronavirus name. So this is the mRNA that is in the vaccine. And when it's delivered to us, it actually allows our own mRNA in our cells to make a little bit of that spike protein. And then after it makes a little bit of spike protein, the mRNA in our cells gets degraded. So it doesn't change our DNA or anything. But what it does is our body is like, oh, I see this particular spike protein. That's kind of odd. That doesn't look like Sharita if I use myself. So what it does is it causes your body's immune cells to make antibodies against that protein. So then that means the next time that you see a coronavirus, the COVID-19 coronavirus, my body's going to say, oh, this doesn't look like Sharita, and it's going to mount a response and kill the virus. So that's how the mRNA vaccines work. That's how Pfizer and Moderna work. The other vaccine uses a protein subunit, and that vaccine is not being used in the US, but basically it contains pieces of the protein in it, the protein subunit. And again, it's injecting that subunit, causing your body to make an immune response. And then the other kind is the vector vaccines. These are more traditional. The Johnson & Johnson vaccine is an example of this. So it uses another attenuated virus that is safe. And again, it has that spike protein inside the virus so that when you get the vaccine, it causes your body to mount an immune response to that spike protein. So those are all of the things just for you to understand like how the vaccines work. The Pfizer and Moderna vaccines are given in 2 shots in the upper arm, 3 weeks apart for Pfizer and 4 weeks apart from Moderna. The Johnson & Johnson is 1 shot. With the shots, it takes about 2 to 4 weeks after the second shot for Moderna and Pfizer, and after the 1 shot for Johnson & Johnson for your immunity to kick in. So that's important to know because, a lot of people thought, oh, I got my first shot, I can throw caution to the wind. Not exactly. You can't really be fully protected until after 2 weeks after that second shot. And then I think even after vaccination, it's possible that you might pick up the virus and carry it and give it to others. Chances are you would have an asymptomatic infection, so an infection without symptoms. But part of the reason that even though I'm vaccinated, I'm still wearing a mask is because I don't know who in the public is still unvaccinated and want to make sure that they're being protected. So I just wanted to just reinforce that you have this information, but all of the vaccines are very safe and effective. These vaccines are highly effective compared to some of our other vaccines, and really across age, gender, race, and ethnic groups, across people with various comorbidities. Again, you will have this handout that shows you the percentage of participants in the trials who are in different race and ethnic groups. And so I hope that answers some of the questions that you have. And I just want to stop sharing for a moment and say that I think it's really important to figure out, if you haven't been vaccinated yet, what is your why? Who is it in your life that you want to protect, that you don't want to get COVID? And so for me, that was my parents. So I'll show this picture on my desk. They both turned 85 during the COVID-19 pandemic in 2020. And I felt like I spent the whole year trying to keep them alive. So when I got my vaccine, that was my way of doctor putting my own oxygen mask on first, so I could make sure that, when I interact with them, they're protected until they could get their vaccines. So I just want to encourage you, and also to point out that now many of our older adults are protected because they were in the first group of people that got vaccinated. But what we are seeing now in our hospitals and in our infections is that it is young adult and middle-aged individuals who are still getting infected with COVID. And I will share personally that a close friend of mine who would have celebrated his 54th birthday last week died from COVID-19 in March and really did not have chronic medical conditions or anything. So this is still very, very serious. And the way that we can fight it is to get infected. There are reasons that certain communities, particularly our Black community, feel some kind of way sometimes about our medical system because, in the past, our trust has been violated. But there are allies on the inside now. And I just want to say to you that if you get sick with COVID, you're going to end up going to the very place that you have said that you don't trust. So it is better to be on the prevention side of the medical system with the COVID-19 and not be on the treatment side on a ventilator, really praying for someone to be able to save your life. So I'll stop there and be happy to address any questions that have come up in the chat.
Thank you so much, Dr. Hill Golden, for your helpful information. So we'll now take questions for Dr. Hill Golden. As a reminder, please type your questions into the Q&A box so we can read them to our speaker. I do see that we have a few questions coming in. So one of our first questions is, my son has a peanut allergy and is hesitant about getting the vaccine. Will it be safe for him to take?
So it will be safe. What I would suggest is that your son, you and your son speak with the allergist that he's been seeing, and just make sure that there are no concerns. But people who have had food allergies have been tolerating the vaccines well. But we recommend that you talk to your allergist so that they're aware that you're going to get the vaccine, and they may recommend Benadryl or an antihistamine to take around the time of the vaccine, but people have been people with food allergies have been tolerating the vaccines well. But I would definitely do that in conjunction with a conversation with the allergist.
Thank you so much. We have time for one more question. A recent article in PubMed stated that those who have taken a second pneumonia vaccine are 35% less likely to have serious COVID disease. So how does that help those who can't take the COVID vaccine due to serious allergy?
That is an excellent question. I was not as aware of that study. So there may be some, cross protection. Now, the pneumonia vaccine is protecting against a bacterial infection, which is different than a viral infection. And so I think what will end up happening is we'll have to see long term how those results pan out.
All right, thank you so much.
And there was one other question I saw, if I could just take the liberty of asking about wearing masks outside. Even though the CDC guidelines say that if you're fully vaccinated, you do not need to wear masks outside and not indoors with other vaccinated individuals. But because we don't know who in the in our external community is not vaccinated outside of our homes, I think it's better to err on the side of caution when you're not certain, to protect others.
All right. Thank you so much, Dr. Hill Golden. This has been very informative.
The next item on our agenda is our speaker panel on health and spiritual wellness. Today's panel will include presentations from 4 speakers. Each one of our speakers will present for about 10 minutes each, which will be followed by a Q&A session at the end. As a reminder, please type your questions in the Q&A box at any time during the panelists' presentations. Our first speaker is Dr. Thomas Cujo, who is an assistant professor of geriatric medicine and gerontology at the Johns Hopkins School of Medicine. His clinical research expertise examines how social factors impact the physical and mental health of older adults. Today, Dr. Cudjoe will share his expertise on holistic approaches to physical and mental health and wellness. Please join me in welcoming Dr. Cudjoe.
Good morning, everyone.
Good morning.
Good morning. Oh, I appreciated that response. In in-person settings, I'm always anticipating the call and response. So it's good that I hear that someone was able to do that this morning. Just trying to find the screen share. Give me a second. Can everyone see my screen? Yes, I'm assuming.
Yes, we can.
Great. So good morning again. Thank you for the generous introduction. Thank you, Dr. Golden, for your remarks. I think all of the points that she made are critical as we think about how do we optimize, how do we maintain holistic approaches to health and wellness. So thank you again. So I'll jump right in and share a few of the things that I think are important for us as we think about how do we age in a healthy way. The three pillars of maintaining or optimizing our health as we age are these things that I have here on this slide. And they are promoting health, preventing injury, and managing our chronic conditions. And so this is doing the things that I'm sure we have learned over the course of our life, working with our healthcare providers on managing these conditions, as well as thinking about ways, learning ways to optimize our physical and cognitive health and mental health. And then lastly, doing things that facilitate social engagement. And so as I move forward, I'm going to share a little bit more about each of these, but this is kind of the framework that I think if we keep this image in our mind, I think we are all on our way to living healthy lives. So I think as I've gone through the course of my career and even life before I was in medicine, there were always older adults who I interacted with and my family and friends who, I wondered, what's their secret for living a long life, looking great at 90. And so some of these things that they're not really secrets because I think we know many of them. I think some of these things over time are clear and in plain sight. It's just a matter of implementing them. And so hopefully today I'll remind each of you and remind myself of what's the secret, what's the way that we age in a healthy way or promote healthy aging in our own life, in our families and in our community. So this work these points that I will share in the next few moments all are evidence-based. They all come from research, and this information can all be found on the National Institute on Aging website and program materials. So this is something that is easily accessible after our conversation today. So the 4 points that I want to dig on a little bit deeper today are the following. The first, get moving. The importance of exercise and physical activity. Also, paying attention to our weight and shape. In addition, the third point is maintaining a healthy diet. So by consuming healthy foods and thinking about what we eat. And then lastly, participating in activities that we enjoy. So exercising or physical activity, as I prefer to refer it to, sometimes exercise has a connotation that means different things for different people. So some of the language that I prefer to use when I work with patients is how can we improve or increase our physical activity? So we know that physical activity is a cornerstone for healthy aging. Studies have consistently shown that individuals who have higher levels of physical activity live longer and better lives. We also know that physical activity and higher levels of physical activities mitigate some of the chronic conditions that we know increase our risk for having shorter lives and lives that are of less quality. And so mitigating those chronic conditions like diabetes, hypertension, high cholesterol, exercise, physical activity is critically important. And this is not something that I think we have to go to the sporting goods store or buy a bunch of videos or buy special clothes for. This is something that I think we can begin doing even here today while you're listening to me talk. This is as you're sitting in your homes or wherever you are, as you're listening on your phones or at your computers, this is moving your legs periodically. This is stretching your arms. This is the chair movements in our sedentary lives in some instances is very important in terms of maintaining levels of physical activity that can promote health. Moving on in terms of thinking about or paying attention to our weight and shape. We know that health problems associated with being, there are health problems associated with being overweight or underweight. So maintaining and paying attention to our weight, shape of our body is critically important. One of the things that is often referred to or discussed is how our body fat is distributed. And so this body fat distribution matters. And so one of the analogies, I guess you could say, that is often used is the comparison of the distribution of fat being either apple, a person's proportions being apple shaped, that's more upper body and abdominal obesity versus lower thigh gluteal area obesity or fat distribution. And so we know that individuals who have this more apple shaped proportion with the thoracic and abdominal obesity have higher risk than individuals who have this pear-shaped fat distribution. And so, but that's not to say that, and so this is something that we have to acknowledge and identify that these things pose different risks, and that one size in terms of this weight shape distribution doesn't fit all. And it's important that we talk to our doctor about, what things we need to do to mitigate our risks associated with our weight. Moving on, the third point that I want to stress is around healthy food, being mindful and thoughtful about what we eat. And so this is eating more high fiber cereals, low fat dairy, fruits, non-white breads, whole grains, beans, vegetables, and avoiding and eating less of the processed foods, fast foods and soda. So that's typically in our grocery stores, that's going and consuming the foods that are on the outer borders, things that are not in all the packaging and wrappers that are there in the many of the middle aisles in our grocery stores. That's eating the things that you can see on the green side of this image compared to things that are on the red side. So we want to do more of these fresh fruits and vegetables, more unprocessed foods. When we do this, we know that that promotes healthy. And then lastly, participating in activities that we can enjoy. We know that engaging in activities that individuals enjoy can lower risk for health problems. And I'm not talking about consumption of alcohol or smoking. Some people may enjoy those things. We're talking about engaging in activities where people leisure activities include reading, playing board games, playing an instrument, dancing. All these things promote healthy aging and have been shown to lower our risk for dementia. And we know from studies that older adults who participate in social and productive activities live longer than individuals who are not participating in these activities. So as you sit at home and you're taking your notes and thinking about, how am I going to live a healthy life? You just put these things on your checklist that I need to move more, move now, start now, even during our conversation today. Being attentive to my body size, eating more fruits and veggies, and avoiding these processed or fast foods. And lastly, staying social and productive. These are my references, and I'll take any questions.
Thank you, Dr. Cujo, for that excellent presentation. Our next speaker is Dr. Dorothy Weir, who is a family nurse practitioner and primary care provider for MedStar House Calls here in Baltimore. In this role, Dr. Weir provides support to older adults, individuals living with dementia, their families, and caregivers. She also serves as an advocate for health policy legislation and has led free health screening clinics and missions in Baltimore and abroad in an effort to address the health disparities. Dr. Weir will discuss the importance of physical and mental wellness in combating caregiver stress. Before we begin, we invite our audience to respond to another quick poll question, which will appear on the screen now. Thank you for responding. Our poll indicates that 44% of the people attending today are not caregivers.
Thanks, Ernestine, for the introduction. And I'm gonna wait for my slides to come up. Great, thank you. So today I will be talking to you about caregiver and being in that role and just how you can be able to stay, because with memory loss, some of it we see starting quite early, and sometimes you may have to stay in this role for so many years. So it's really important that you maintain your physical and mental health to be able to participate in the role and take care of your loved one. Ashley, if you can move to the next screen, please. So basically in the United States, we have about 16 million people providing care for their loved one, giving about 18 billion hours of unpaid caregiving every year. And 85% of the caregivers for the elders in the United States are usually family members taking care of a loved one. Next screen. Okay. So what's caregiver burden? Sometimes we take care of our loved one with so much love, but then you feel strained, you feel exhausted, and some people tend to feel guilty about feeling that way, thinking that maybe they're failing their loved one, they're failing in their role. I would like to remind you that caregiver burden is actually a medical diagnosis. It happens, it's not only you, and it's when an individual caring for a loved one becomes emotionally, physically, socially, even financially exhausted, and probably feeling so burdened that you're not able to do this and maybe need help. And sometimes it also happens to professional or paid caregiver. They can get a little burdened and exhausted taking care of a patient. So how can you manage stress? It's important that you find support and discuss your feelings, whether with other health professionals involved in the care of your loved ones, or with family members, with people you interact with. You also have to set limits in your caregiving time. You can't do this 24/7, 365 days. You will get burdened quicker. It's also important to become an educated caregiver about the disease process and how you can handle situations. Be sure that you're discussing what's going on with your employer, your friends, so that people are not expecting too much of you. You also have to accept changes when they occur. There are times that, it's time to give up, time to make changes. You always have to be able to do that. Also make legal and financial decisions. You have to establish advanced directives and things like that, so that when that time comes, it's easier to refer and go with your plans. You also have to take regular breaks. Please try not to isolate yourself. Don't think you have a solution to everything. It gets overwhelming. And don't be in denial, accept things as they come. Next slide. So I will go through a few case scenarios. Some of them are real, a lot of it is changed a little bit to protect identity and all that. And some of it is hypothetical. So we have Miss Y, who is a 73-year-old patient with dementia. Her family has kept her home. They're providing care. She has 3 children, Jane, Janet, and James. James lives out of town, but Janet and Jane are local. So they provide care in shifts. James comes about every 2 weeks and spends time with mom. Janet still has a job, so Jane is there all day. Miss Y is very aggressive towards Jane for some reason. Jane is there all day, every day, providing very good care for her. She actually calls her that lady because she has forgotten her name, and that's seen a lot in the dementia disease. So Jane is becoming very overwhelmed because she thinks, she's one of the children, but she feels she's being treated differently. So question to you, do you think Miss Y's actions are intentional? That's something to ponder about. Could be yes, could be no. They had a difficult relationship even in childhood. Should Jane step back from caregiving for her mental health and well-being? She might need to make some difficult decisions. It may be time to discuss this with her siblings and probably step back so that she can stay healthy for herself. We'll move on to our next case study. The second case study is Miss Clayley. She's taking care of her husband who has dementia. He suddenly goes missing. She can't find him. Couple hours later, he's found with his car parked by the highway. He ran out of gas. So he apparently got out of the house and drove away with the car. This can be a very distressing thing to caregivers. What do you do at that point? It's important to remember in the beginning, I talked about planning. So you have to know when to give up his car. You have to know when to self-proof the house. You have to know when to, when his license needs to go away and things like that. So this could have turned out very dangerous. And when safety becomes involved, it's now time for you to start reevaluating, am I able to keep him at home? Am I able to keep taking care of him? Is it time to think placement? Is it time to bring in more services to help? So such situations, should trigger thoughts that maybe there's time for change. So because of time, we will move on to our third case. And then at the end, I'll give an overview of things that we could probably do in some of these scenarios. So we have Mr. Mann. He's a patient with dementia who has a paid caregiver. So the paid caregiver is giving him a bath. He turns around, he grabs her butt. His wife is present. She scolds him and walks out of the room. The caregiver turns around and says, "What's that about?" But she has a smirk on her face. She seems amused. On a second occasion, same thing happens. She's washing him. He grabs her breast. The wife is distressed because they have past infidelities in the marriage. So in this case, his actions are probably not intentional because dementia, sometimes you can see inappropriate sexual behavior depending on what part of the brain is affected. How you respond is important. The wife walking out could be misconstrued as she's giving me privacy. The caregiver probably should have reacted differently and stayed firm. So the way you respond to these situations can actually make you a participant or can help you stop the behavior so that next time it doesn't happen again. So we will move on to our next slide. So as a caregiver, stress is real. Like I said, it's not a sign of weakness. It's always important to reach out because there's help out there. Know when it's time to seek alternative arrangements in terms of treatment, in terms of caregiving. You can also discuss these issues with your healthcare provider. Sometimes medications do help us manage the aggression, will help manage even the sexual behavior, because it's not intentional. It's an action based on the changes that are going on in the brain. So sometimes we are able to help with that. And don't forget, you, the caregiver, your health, your physical, mental being is very important. Even your financial being is important in this caregiving situation. So it's very important that you stay healthy so that you're able to provide good care for your loved one. So please know the resources in your community, know when to tap on them, know when to discuss what's going on, and just really stay in the loop of what's going on in your community, basically. So that ends my brief presentation. I think my time is running up, so I'll give it back to you and see if there are any questions.
Excellent. Thank you, Dr. Ware. I wholeheartedly agree with the importance of caregiver wellness, both mental and physical. Having been a caregiver myself, I understand the importance. Continuing along the caregiver theme, our next speaker is Ms. Marlon Taylor, who is the Diversity Inclusion Lead at the Greater Maryland chapter of the Alzheimer's Association. She's also a family care coordinator who provides education, support, and service resources to caregivers and families of individuals living with dementia. Ms. Taylor will speak to us about the Alzheimer's Association resources for caregivers. Before we jump into Ms. Taylor's presentation, we ask our audience to answer another poll question about caregiving resources. This question has appeared on your screen now. So would you answer the poll question, please? Thank you for responding. We have a smart audience. Our audience, 72% of our audience said true. If you're concerned about a loved one's memory, I would contact the Alzheimer's Association 24/7 health line for information. Now I present Ms. Marlon Taylor. The Zoom stage is yours.
Well, thank you so much for the introduction, Ernestine. And I love the results of the poll, but I see that the Alzheimer's Association still has work to be done with the unsure response as well. So again, I bring you greetings from the Alzheimer's Association, the Greater Maryland chapter. And I noticed earlier that I saw one of the attendees was from New York. So let me first say to you that what I'm about to say will apply to most, if not all, of the Alzheimer's Association chapters throughout the nation. So you just would need to contact them for certain programs that I'll introduce to you. Next slide, please. So some of our local services and education that we offer at the Greater Maryland chapter of the Alzheimer's Association. The first, the 24-hour helpline, that is nationwide. The number that you saw, the 3900. It's a nationwide number. It does not matter where you're calling from, Hawaii, California, it's still the same number. So that stays as is. You can call that number for anything. We'll get more into that on the next slide, I believe. So we have support groups. Our chapter does at this time offer a respite care program, care consultations, that is throughout the helpline, as well as within each different chapter, early stage programs, education programs, trial match, and then we'll review some of the online resources as well. Next slide, please. So our helpline, as you know, it's 24/7, 365 days a year for anything, any type of telephone support that you need. When you call that number, you can get any type of information. The staff is trained clinicians, MSWs also are on the line there. We have a language line, which will, it's over 200, I believe, over 200 languages that you can call in for, and we'll be able to speak with you however. The next slide, please. So just to briefly talk about the helpline, when you call that number, the 24/7 helpline, the staff there can help you to understand memory loss. Let's just say you just received the diagnosis, or you're not even sure. You see a loved one that's, not quite acting as they normally act. You can call there to ask those types of questions. You can call about medications. If you call about a loved one and you're not sure, they can send you some information, something like knowing the 10 warning signs of Alzheimer's or dementia. So again, they can guide you from step to step. We can help you on the different FDA approved medications and the treatment options that are out here, general information about aging and brain health, as we heard today from so many of our doctors, skills to provide quality care, learning about different things out here. Again, you just heard it this morning. We have a database of local services and resources that we'll get into just within a few slides. And again, as Dr. Ware stated, getting that legal and financial arrangements, planning for that. So it's just so important to know about that. We can help you with that. We can provide that education for you. The next slide, please. So one of our programs is our support groups. We have over 36 support groups that are still moving forward right now, and due to COVID, they were all transitioned from face-to-face to virtual formats. We are in the process now of opening them up due to the vaccinations moving forward. So we still will probably have both virtual as well as in person, depending on each separate support group. All of the support groups are scheduled per month. It's confidential. You don't have to worry about anything moving outside of that sphere. What does the support group provide? It provides that emotional support, that education, just sitting in there and just getting the information from other caregivers who are walking the same journey that you are walking and caring for your loved one. What did you do for this particular behavior, or how did you handle that? It's just being reinforced and letting them know you're not walking this journey alone. We also have some specialty support groups. We just added 2 more support groups. The first one is our dementia caregivers during COVID support group. So that, again, the focus is on the unique challenges that COVID has brought to any family members. We also have a support group now, the new one, the COVID grief and dementia early stage support group. So if anyone has passed due to COVID, we have a support group for that as well, because we know there are so many emotions just in caring for your loved one. But again, just as Dr. Ware just says, you have to take care of yourself as a caregiver to be able to care for your loved one. Can we move to the next slide, please? So our respite care program, right now we do have a one-time respite grant up to $500 for caregivers. You can reach out to me. I oversee that program, and it's planned or an emergency situation. Again, as you can see with the example, you can use it for in-home care to, pay someone else to come in and care for your loved one. You set the tone, the hours, the activities that you would want that facility or that neighbor to do, to be paid for that. It's totally up to you, but you can reach out to myself for that, or when you call that 24/7 helpline number, they can give you the information for who you need to contact for that as well. The next slide, please. Care consultation. This is so important. I love that the Alzheimer's Association offers this. When you do call the 800-272-3900 number, there is a free 1-hour care consultation. There is no limit to how many times you would want or need to consult with someone. When you call that number, it will only be via phone or email. As far as for the in-person part, that's within the local chapters, such as the Greater Maryland chapter, where before COVID, we would actually go to the person's home or wherever they wanted to meet. Right now, what I am delivering is the virtual format, where it's about planning. It's about discussing what's going on in your life. What needs do you see that you need? And again, that's part of our assessment part, is the needs, identifying the issues. And then after we have that discussion, actually sitting down, working out an action plan. Again, Dr. Ware spoke on that as well. You need to plan so that everything does not consume you at once, so that within each part of this journey, you have a plan where it's all you need to do at that point is to execute it. Family meetings. A lot of times there's so much going on within the family where everyone doesn't agree as to what should be done. Again, this is something that we can hopefully help you with, whereas we can come in and be something like a moderator, whereas we're giving out the facts, not you. Sometimes people think, within the family, they don't know what they're talking about. So come to the Alzheimer's Association. We can help you and work with you in that. The next slide, please. So our early stage programs, right now, again, everything is still in a virtual format. All the programs we have now, they were all face-to-face prior to COVID. Again, our educational programs, we have a number of educational programs that might be on the next slide. I'm not too sure, but this slide here shows one of the Baltimore City Zoo persons working with a penguin, I believe. So this is something that they were able to go to. We paid the fees for the early stage caregiver, as well as the person living with the disease. They could go for free to the Baltimore Zoo. Right now, we're just going through different zoos within the country and showing information. We also have, with the Baltimore Walters Art Gallery. We still have that in a virtual format. So we have a number of early stage programs that people can attend for free. Everything is for free that the Alzheimer's Association offers. The next slide, please. So our education and training, the community education programs, we have so many education programs, from knowing and learning the 10 warning signs, understanding the behaviors, how to respond to the difficult behaviors associated with dementia. planning, legal planning and finances, how to manage, your money and things like that. So there are so many programs that we offer. Those that we offer in the virtual format right now, you can also take the same trainings once you access our website, alz.org/Maryland for our Greater Maryland chapter, or just alz.org. You can access the trainings for free on our website. And just a mention of some of our annual conferences, as you can see listed here. We did cancel our Baltimore Spring Conference. It will be held again April 8th in 2022. The 50th A and Virginia I. Jones African American Forum on Memory Loss will be held again this year in a virtual format, November the 6th, 13th, 20th, and December the 4th from 10:30 to, I think I have that time wrong, whatever. It's a 90-minute program each day. So we're definitely just so excited to continue to offer that program, that forum to you. And then we have some other forums that we normally sponsor in those 3 areas, Frederick, Salisbury, and Upper Shore. So you can reach out to us for any of those information, about any of those programs and education forums. Next slide, please. So again, okay, here is the programs. So again, these are some of our education programs that we're offering in the virtual format. Again, you can access each and every one of them on our website and work at your own speed. So Healthy Living for Your Brain and Body, as Dr. Cujo reviewed today, we have that legal and financial, effective communication strategies, living with Alzheimer's. That series is for both. It's for those that are living with the disease, again, as well as for their caregivers. It's an excellent program, understanding and responding to dementia-related behaviors. So all of these programs are continually being shown in the virtual format. And again, you can access them at any time at our website. Next slide, please.
1 minute remaining.
Thank you. Trial Match. This is something that the Alzheimer's does. It's a good program. It's a good service. It takes all of the work off of you to figure out what's the best trials for you. So all you would need to do is to fill out a form, and you can submit that, and then they will return it to you to let you know, based on your submission, what programs, what studies are best suited for you. Next slide. You can, again, get that information by just calling our 24/7 helpline number. And here are just some links to some of our online resources. Again, if you, let's just say you really don't want to go face-to-face or do the virtual support group, we have Alt Connected. That's our online support group. The Community Resource Finder is an excellent online database that's open to the public. It's really focused on any resources that you need for older adults, anyone with any type of memory loss. You can find in-home caregivers there, elder law attorneys, any type of living facility there. So it's just so much information, as well as our advocacy and volunteer information on our website. Next slide. We can skip that. That's really for physicians and things like that. So again, all you need to do is visit our website, alz.org/Maryland, our Facebook and things like that. So again, I thank you for allowing me to present. And I think that is it.
Thank you, Ms. Taylor. An excellent overview of the host of resources provided by the Alzheimer's Association.
Thank you.
Our final speaker is Chaplain Tamika Milton. Chaplain Milton is the supervisor for the Clinical Pastoral Education Program and the Chaplain Residency Admissions Coordinator at Johns Hopkins Hospital. She is committed to the local community through her engagement with church ministries and providing community education. Chaplain Milton will speak about spiritual wellness. Before we begin, we invite our audience to respond to our final poll question about self-care activities. This question has now appeared on your screen, so you have 30 seconds to complete your poll. Thank you for responding. While we do have an informed audience, excellent. 81% says that prayer or meditation is a restorative practice to incorporate into your regular routine. So we're on the right path. We have 84% that says mentally stimulating activities such as reading for pleasure, puzzles, and games is a good restorative practice. And then another 78% said spending time with loved ones. Thank you so much for responding. Chaplain Milton, the Zoom stage is now yours.
Thank you so very much, Ernestine. I'm truly delighted to be here this morning and to share from a topic that I'm very passionate about, not only spiritual care, but the importance of cultivating a holistically healthy life. And so today we're not only speaking and engaging from the perspective of caring for others, but caring for yourself. I'm always reminded in conversations as such what is mentioned and announced when you board an aircraft, and the instructions they always tell you to secure your own mask before you help someone secure theirs. And when we're talking about spiritual wellness and talking about the importance of spirituality in this shared experience, that's what we're going to talk about. It's first assessing within ourselves where we are and how we are attending to ourselves and addressing the various components that make up who we are mentally, physically, emotionally, and spiritually. We're also going to define the scope and function of spirituality. Oftentimes when we're talking about spirituality, it's automatically related to religion. And while there is some intersection, they are totally different. And then we're going to lastly, identify ways to nurture our spirituality or spiritual life towards a more holistic well-being and livelihood. So just as we move into our time together, I invite you to take 3 deep breaths, and I'll lead you in that. So inhale and exhale. Inhale. You may want to close your eyes, exhale. Last time, inhale, exhale. And I invited us to share in that centering exercise to engage and get more in touch with your core, with your center. Oftentimes, the busyness of life and the ebb and flow of life can cause us to pay more attention to our existential, to our physical, to the outer components of who we are. And in preparing for this presentation and this conversation, I came across this Dutch proverb, too much of one thing is good for nothing. And so oftentimes we are just so much energy, time, and attention is given to our existential. Too much time is given to what's going on existentially, and not enough time is given to our inner being. And so when we're talking about our spirit, it's important to recognize that we are spiritual beings having a natural experience. We are spirits with a soul and a body. And when we're talking about our spirit is the natural dimension of every person. This is why, irregardless of your faith tradition, your belief, or spiritual practices, there are ways that we can connect in community by way of our spiritual orientation, our spiritual createdness. And that is so important to emphasize as we're discussing this today, the importance of spiritual wellness. That if you leave this conversation with nothing, while there's been so much just great information that's been shared by all the other panelists, from this conversation, from my talk with you, I want you to remember that you are a spiritual being having a natural experience. And so it's the importance of knowing that is that it is instrumental to always recognize where you are spiritually. Where am I within my purpose? Where am I within the meaning of my life? Where am I within my love tank, if you will? And how I am engaging myself spiritually with all that has taken place over the last year and a half and prior to, I believe, and I have experienced myself becoming off-kiltered with my spiritual self. Doesn't mean that I'm not praying, doesn't mean that I'm not, practicing certain acts that help to cultivate, but I haven't paid enough attention to how I am productive and progressing in a wellness state of my spiritual being sometimes, which is why I invited us to take those deep breaths in. Sometimes it takes being still to recognize what it is that I need, what it is that I need more of, what it is that I need to extract possibly from my space and from my daily routine. There's a psychologist by the name of Naeem Akbar, and he's more so known within the school of personal psychology or self-psychology. Heinz Kohut, we know as the father of self-psychology. But what I appreciate about Naeem Akbar's work is that he envisions the self as a community. The self is its own community. And if we look at this diagram here, where we're seeing the body, the soul, and the spirit, this is your community. So I pause and invite you to consider the question, how have I been attending to my self community, my community as a self? When we talk about the self as a community and spirituality being, or our spirit being a key component to the community, in defining how we understand spirituality and the nature of our spirit, I really appreciate Dr. Pachowski's definition of spirituality. In thinking about the scope and function of spirituality, it is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience a connectedness to the moment, to self, to others, to nature, and to the significant or sacred. So to the divine, to God, to the holy. How a person refers and express meaning and purpose in these ways through connectedness. So when we're thinking about spirituality and the importance of cultivating our spiritual lives through all the stages of life, each and every day, one day at a time, if you will, it's important that we gauge how we're connecting with self and how we're connecting with others. The poll that was just taken around active restorative practice, how do you take time to refill your tank daily, spiritually? There are things, and I've heard one of the panelists talk about the burnout, but there's compassion fatigue, and there are all other ways in which we can find ourselves depleted. And if you are a care responder, then it is so important that you are taking assessments, daily assessments of where you are within your sense of self, because you are only as good to the individual that you're care responding to as you are good within your sense of self. So when we're talking about our spirit and engaging the spirit, we're talking about engaging from a place of love and our sacredness, compassion, being and engaging and practicing forgiveness, responsibility, engaging the spirit invites a sense of wholeness and harmony within oneself, again, within your community of self. And then it brings happiness not only to self, but to others. I like and appreciate this description of spirituality from the Professional Association of Chaplaincy, which recognizes that spirituality describes an awareness of the relationships with all creation and an appreciation for presence. And I don't know about you, but since COVID, not only the health pandemic, but the social pandemic we've been in as well with the civil unrest, that I've taken time to be present with myself, and I've appreciated the awareness that have come from me being able to attune to myself and see what it is that I need to do to replenish, to regroup, to reground, and to reframe certain things within my livelihood. So in addition to recognizing how we engage our spirits and the different components that go into engaging this spirit, I want to really talk about and we'll probably highlight some ways that you can nurture your spirituality. And in the book, Care of Mind, Care of Spirit, Gerald Mays recognizes that spiritual formation is really essential to your growth and development as a whole person. And as mentioned before, it can entail spiritual practices like prayer and your spiritual journey of getting closer to God or a higher power, but it includes everyday interactions with yourself and with others. And so checking in with yourself, the first step will be, or first task or practice would be spending some time alone to increase your everyday spirituality, being able to engage where you are and what you need to do to live healthier and more vibrantly. Giving to others. As a servant, I'm a servant leader. I love serving in all different capacities in the community, in local parish, seminars, workshops, and so forth. And that is very life-giving. For me to be able to give back and to volunteer and to extend compassion and information, to be able to offer. One of the metaphors that I use with my students is, who are chaplains and pastoral care providers and spiritual practitioners, is that it's important, this idea of a reservoir that is often, and if you're in any type of helping profession, as much as we're pouring out, there should always be a constant flow of pour back in. In other words, thank you. In other words, it's important that we drink as we pour in order to remain replenished. I also recommend prayer, in meditation and exercise. I believe Dr. Cujo mentioned this before, the importance of being active to also cultivate and nurture your spiritual well-being. So I'll conclude with acknowledging my personal definition of spirituality is that it's an awareness or connection to God's presence or the Holy's presence or higher power's presence. And it's an intentional response to creation and to others that can be understood as a sacred experience. It has been mentioned, spending time in nature, spending time with loved ones, all of this can improve your life. It can help you make healthier choices. It can decrease anxiety and depression and anger. It can lower blood pressure and the risk of heart disease and so many other things. But being intentional about cultivating your spirituality through all stages of life is instrumental to living a healthy, vibrant life. So thank you.
Thank you, Chaplain Milton, for your calming, centering voice. And thank you to all of our expert panelists. I certainly found your presentations to be informative and full of valuable information, and we hope our audience did as well. Panelists, we now request that you turn on your cameras for our panel Q&A session. Audience members, please remember that you can type your questions in the Q&A box at the bottom of your screen. The questions will be read by our panelists, to our panelists by our moderators.
Thank you all. We've been receiving some wonderful questions. Panelists, we're going to be trying to address as many questions as possible, but at the end of our panel discussion, please try to respond to any remaining questions in the Q&A box. So we have quite a few questions coming in, and this one goes out to the entire panel. So how can I get an older adult to exercise or engage in social activities if they're tired or resistant to them?
Yeah, I can try to address that question. So one of the things that I tried to share in my statement, our statements earlier was, I think joy is important. I think encouraging people to do things that they enjoy is important. And then I think also we want to move away from thinking so much about exercise, but just talking about physical activity. And so that may be simple things like getting up, walking to the door, or that may be moving our arms and as we're sitting. Any activity, I think, is where we need to begin, particularly in individuals who have not historically been physically active. And I think once you start that, then that leads to people being more encouraged about the things that they can do, and you continually build on that.
Yeah, I agree. When I think about how a person can be engaged and involved, I think about self-care, and the simplest definition of self-care is doing what makes you feel more like yourself. So it may not be exercise, it may be dancing, it may be listening to music or doing something that the individual enjoys, engaging them around what is true and meaningful and purposeful for them. And then probably inviting some more energetic ways and active ways in which they can practice that particular exercise, if you will.
Just to add on a little bit, when you're dealing with these individuals with memory loss, you have to get a little creative. You have to make sure every effort is not triggering. So instead of saying exercise, you can go back to things they loved to do before they got sick. You want to go shopping, so that it's not walking around the yard, but probably walking through the mall or grocery store and things like that, just to get the activity in. Thank you.
Excellent questions. Here's another question from the chat. The elderly couple I take care of love Southern food, ham, hock, and all. They will not eat the foods if it lacks the flavor that they grew up with. How can I fix healthy foods with soul food taste without the pork, the salt, etc.?
Yeah, I love that question, and I have to admit that I'm from Southern heritage. I grew up in Georgia, so I can identify with the cuisine, and I just want to acknowledge that this can be a challenging thing for us as we prepare meals for individuals that appease the palate, that we enjoy. And so I acknowledge this is a challenge, but I also want to acknowledge that there's a history that is related to our foods, and there's a connection to the foods in ways that I think we don't even fully understand. And this connection to the food ways that exist from the past and what was available to make dishes, and so we've developed an affinity for certain tastes, and changing that affinity is difficult. And so that we can't just turn this on overnight. I think it takes time to slowly withdraw some of the seasonings that we use for foods and replace them with things that I think can also be equally fulfilling to us, our taste buds and everything that goes along with it. So I think that we do have to change some of those dietary preferences by shifting the seasoning of our collard greens, and everything else with things that we know are not as harmful to our health. Study after study has shown, or there are studies that have shown that Southern cuisine prepared in the forms that I think that the questioner put forth have shown to lead to higher levels of hypertension. And so we have to gradually change what we use to season. But also I think it's important for us to note that some of these foods were associated with celebration, and that our way of life was different when some of these cuisines were established. We were more physically active at the time. And so using these foods and consuming them on a regular basis is not advised, and that we have to gradually work to change this, what we use to season foods and so that we can optimize our health. So I would encourage the questioner to begin trying to, replace the salt with other seasonings that I think can be equally appetizing.
Thank you. We have a couple of questions that are coming in about the early stages of Alzheimer's disease and dementia. If you're starting to notice them in yourself, what are some resources that you can reach out to?
Again, from the Alzheimer's Association, we have plenty of resources. We have documentations that will help you as a checkpoint to say, okay, I'm noticing these changes in myself or someone else that you know. So we can definitely help you with that, walk you through that, so that you can look. And again, knowing those 10 basic warning signs, that's something else that we can give out to you. So yes, by all means, just contact the 24/7 helpline number, 800-272-3900. And we do have documentation for both, yes.
Great question. Here's another one from the audience. Do trials include genetic testing?
As far as for the Alzheimer's Association trial match, I don't know. I'm going to say I don't know because there are so many different types of trials for, for whatever is going on. So I just can't say yes or no to that. That's something that you can, again, contact the 24/7 helpline number, and they will connect you with the trial match department to answer that for genetic testing, if that may be part of a particular trial.
I think Corinne can answer that question for us. Corinne, can you answer that question for us?
Thomas, would you like to?
I will encourage people to refer to the resources that with our memory center. This is not something that I specifically engage in regularly in my practice. I imagine, as has been previously suggested, that various trials have different focuses, and some of them may include assessment of individuals' genetic risk, and some may not. So, but specifically, I would go and get information from our memory center.
All right, we'll take a couple more questions, but panelists, please respond to any remaining questions after we're done by responding in the Q&A box. Our next question is, are support groups for caregivers led by instructors?
For the Alzheimer's Association, all of our support groups are led by volunteers who have cared for a loved one with any type of dementia, or volunteers who are actually still caring for their loved one. So yes, all of our support groups, early stage education programs, the same, all are led by volunteers.
All right, thank you all so much for your questions. And again, if there are any remaining questions, panelists, please respond to them in the Q&A box.
Thank you all for all of those wonderful questions. And thank you again to our 4 fantastic, awesome panelists. Since we know that physical activity is good for heart and brain, I'd now like to invite you to get your blood flowing with an interactive exercise demonstration. You've been sitting for a while. We want to get that blood flowing. It is my pleasure to introduce Ms. Renee Briscoe, who will be leading this activity. Ms. Briscoe is a certified exercise instructor in the greater Baltimore area. She enthusiastically merges her passions for exercise and community engagement to promote a positive outlook on physical health and life. A big welcome to Renee Briscoe.
Hello, hello, hello. Can you hear me?
Yes.
Yes, yes, yes. Welcome, welcome, welcome. What an awesome, awesome, awesome time I had listening to all of the panelists. I mean, it was a lot of information, but I have to say myself, my mom, had Alzheimer. And so we had quite a time up until, God took her home. So, but it was really interesting to me because I got to hear even more than what I knew before. So I want to thank you guys for that. Now that I've done that, what I want to do is get you guys moving, a little bit of activity. Yeah, so I'm just going to do one song. You can sit in your seat if you like and just tap, but please engage yourself because it is a healthy opportunity. One question I had for one of the folks there. I'm in a smaller screen. Is there any way I can be in a larger screen?
You are on a larger screen for the audience.
Okay, fantastic. Okay, just wanted to make sure. All right, want to get it going? All right. Nice, simple song, but again, I think it'll be interesting for you guys to get moving too. Yes, I'm gonna cut the volume up a little bit. Yes, I know it's still morning. I think it'll work. Can you guys hear? Can you hear?
Yep.
Yes. Yes. Oh. Yes. Oh, come on, come on. This is not hard. Yes. Yes. Use those hands and arms. Yes. I'm gonna take my right arm and stretch it over. Bring it back. Stretch it over. Oh, it's time to move now. And 1, 2, 3, 4, 5, 6, 7, 8. And 1, 2, 3, 4, 5, 6, 7, 8. And lift those legs if you can. Come on. Even if you can't, lift them high. Bring them up. Yes. And 1, 2, 3. Other way. 2, 3. Yes. Yes. Oh, come on, come on. I know y'all hot, but y'all can wake up. Y'all can wake up. Yes. Easy. Oh, and body right here. Open it up. Those that can, give me that little bit of squat, little bit of squat. Yes. And clap it up. Yes. Yes. Oh, I bet they're happy faces, even though I can't see them. I'm believing they're there. Now we're gonna move our legs. And 1, 2, 3, 4. 1, 2, 3, 4. Yes. Right here, right here. Yes, open those arms nice and wide, nice and wide. And circle. Yes. Circles the other way. Raise those shoulders. Oh, yes. Those that can. Oh, can I get a nice long squat even in the chair? Yes, yes, yes. Bring it up. Hey, top of the morning to you. Oh, come on. You got some energy now. Yes. Higher. Yes. Oh, and 1, 2, 3. 1, 2, 3. 1, 2, 3. Last one. 1, 2, 3. And straight. Left. Right. Left. Right. Yes. Oh, I know that heart is pumping. 1, 2. Leg in front. 3, 4. Right leg. Left leg. Right leg. Left leg. Yes. And up. Ah, come on. Yes, yes. Yes. Oh, bring it up. Yes, yes. I know y'all were hiding, but I believe you did it. I believe you did it. Very good, very good, very good, very good. Yes. So did you?
Excellent. Excellent.
Good, good.
Wasn't that wonderful and invigorating? Everybody's blood should be flowing. I hope you enjoyed being physically active.
Yes. Thank you so much. Thank you so much.
Thank you, Renee.
You're welcome. You're welcome.
Being physically active can be beneficial to your health in many ways. So I encourage you to find activities that you enjoy that are safe for you and try to do those activities several times each week. But don't forget, always consult with your doctor before engaging in an exercise program. Switching gears, it is now my honor to present this year's Holistic Health Seminar Awards, including the Trailblazer Award and the Outreach Leadership Award. This year's Trailblazer Award goes to a man who has made it his personal mission to serve the African American community of Greater Maryland, Mr. Tyrone Quarles. As a certified health and lifestyle coach and health ambassadors for the American Diabetes Association, Mr. Quarles is committed to getting people healthy. He leads educational workshops on topics related to nutrition, exercise, weight loss management, and the impact of diabetes on physical and mental health. Beyond his dedication to community health education, Mr. Tyrone Quarles has profoundly shaped the McCabe's activities through his recent service as chairman of the McCabe board. He has also served as an advocate for caregivers and individuals affected by dementia. Tyrone is constantly raising awareness about healthy lifestyle choices and disease prevention, and is therefore the perfect recipient of this year's award. Without further ado, I am pleased to present this year's Trailblazer Award to Tyrone Quarles.
Thank you all. I am honored to receive the 2021 Trailblazer Award. I would like to thank Ernestine Jolivet, the Holistic Health Seminar, and the McCabe Board for this fantastic award. I have devoted the rest of my life to helping communities in Baltimore City, the state of Maryland, and the nation to understand how to reduce their risk of getting Alzheimer's by adopting a healthier lifestyle. My father had Alzheimer's, so I understand what it is like to care for someone with this disease. I am passionately been showing people for the last 10 years how to prevent or reduce their risk of getting Alzheimer's. I will continue to speak out on how to prevent it. Again, I want to thank everyone at the Holistic Seminar, McCabe, and Ernestine Jolivet. Thank you all for this wonderful award.
The second award presented today is the Outreach Leadership Award. It is my great pleasure to present this year's Outreach Leadership Award to Mr. Jose Jimenez. Driven by his lifelong passion and unwavering dedication to serving older adults, Jose has extensive experiences providing caregiver resources and fostering community partnerships to address the needs of caregivers and families affected by dementia. In prior roles, Mr. Jimenez has engaged with the aging community as the program director for the National Family Caregivers Program, as the program director for the Alzheimer's Association, and as an ombudsman with the Maryland State Department of Aging. He now serves as the Deputy Chief of Community Services with the Baltimore City Health Department in the Division of Aging and Care Services. Beyond these roles, Jose is committed to community health education on topics related to aging and caregiving. In recognition of Mr. Jimenez's outstanding achievements, I can think of no one better to receive this year's Outreach Leadership Award.
Hello, everyone. Good evening. I'm overwhelmed with gratitude to have been selected to receive the 2021 Leadership Award. Thank you all so much for being here to share on this occasion. I'm so honored to have my work recognized in this way by the MCAT board. Each day I go to work, my focus is to try to make a difference in the lives of the people we serve. And it means so much to me that the work I'm so passionate about also resonates with others. These last 2 years have been challenging and have tested our resolve and commitment to everything that we do. However, I also believe it has made us more resilient and focused to what really matters. It has also given us the time to take a step back and evaluate everything that we do as individuals and as leaders who work tirelessly to help others. I believe because of the pandemic, we have been forced to actually think outside the box and not just a phrase that we say casually. This accomplishment is not something that I did alone. There are many others who deserve to share on this award. I would like to thank first God for allowing me to work in a field that helped me make a difference in the life of others, the MCAT board, and all of the partnering agencies and programs who help promote and provide resources to older adults in Baltimore City. My co-workers are at Aging and Care who are as passionate as I am and work tirelessly to help older adults each and every day. My families and friends for their love and support throughout my career. Finally, I would like to thank Ernestine Jones Jalavet and the Jalavet family for their continued commitment to educate, advocate on behalf of families and individuals affected by Alzheimer's disease. As many as you know, my father has Alzheimer's, so the work that I do has special meaning to me. I hope that this recognition of my work can serve as an inspiration to others in the field. Remember, if my work can make a difference, so can yours. I will continue my efforts to help caregivers and older adults to the best of my ability and look forward to continue to work with the MCAT board and each one of you in the audience. In the words of one of Maryland's best advocates for older adults and caregivers, retired Senator Barbara McCuskey, each one of us can make a difference. Together we make change. I'm humble and appreciative. Thank you and good night. Bye-bye.
Weren't they excellent choices? Congratulations again to our two award recipients, Tyrone Qualls and Jose Jimenez. As we start to conclude today's event, I would like to leave you with a call to action. First, I urge you to use the knowledge you gained today to be your own health advocate. Be empowered to take care of your physical, mental, and spiritual health. At the same time, be sure you discuss your health concerns with your doctor, because oftentimes early diagnosis is the key to effective disease treatment or management. Second, be open to the possibility of participating in research studies on topics related to healthy aging, and memory loss. Clinical research is critical to finding a cure for Alzheimer's disease and other types of dementia. It also helps provide an understanding of the health, social, and personal factors that impact physical and mental wellness. Third, identify stressful activities in your life and, where possible, take action to reduce your stress levels. If some of this stress comes from caring for a loved one, utilize the resources you heard about today. For example, consider expanding your care team and seeking help from your local community, government, and spiritual contacts. Last, but certainly not least, I urge you to educate yourselves about health and wellness, especially as we get older. Consider what you can do, what you can control, and make changes to those aspects of your life. Take action. I'd now like to invite the new chairperson of our Memory and Aging Community Advisory Board, Ms. Jacqueline Seth, to turn on her camera and leave you with some closing remarks. Jackie?
Thank you, Ernestine. And thank you for emceeing today. Can everyone hear me?
Yes, we can.
Fantastic. Okay. Thank you all for attending our seminar. A few quick reminders before we end today's session. First, we are inviting all attendees to complete an event survey. The link to the survey will be placed in the Zoom chat and also distributed by email within the next few days. So please take time to do that. And as a token of our appreciation, we will be mailing a special face mask to the first 200 people who complete the survey. Please wear the mask proudly in the community. Second, you should have received a virtual folder by email. Please be sure to explore the host of included resources and don't hesitate to reach out to any of us for any additional information we can provide. The third reminder is that a link to today's seminar will be made available on the McCAB website. This information will also be sent out by email. And for additional ongoing resources related to healthy aging and memory loss, we invite you to follow the John Hopkins Memory and Aging Facebook and Twitter pages. Thank you again to all of our speakers, sponsors, and of course, our wonderful audience. This event would not be possible without you. Please be sure to join us next year for our first Saturday in June, and be sure to bring a friend. We learned so much from you, the community, and we hope you leave today with a greater knowledge about health and wellness and useful resources for use in your everyday life. We extend our warmest wishes to all of you for healthy living, self-care, wellness, and peace of mind. Thank you. See you next year, same time, same date. Have a good day.